So, if you try to cure a yeast infection while using a prescription estrogen cream, you might accidentally spike your systemic hormone levels by nearly 70%.
Yeah, it's a massive jump. And today on the deep dive, we are looking at this wild, microscopic biological drama.
We really are. We're unpacking a highly specific kind of paradoxical relationship for you today.
Right, the interaction between standard vaginal estrogen therapy and active yeast infections. Specifically, we're talking about the fungus Candida albicans.
Because our mission today is to figure out how the mere presence of that active infection and, the very medications you might use to treat it fundamentally alters both the local uptake and the systemic exposure of that estrogen in your body.
Exactly. It completely changes the game.
And we have a fascinating stack of sources to pull from today. We're looking at FDA prescribing information highlights for various vaginal estrogen products.
Along with some really recent pharmacokinetic study.
Right. And some truly mind-bending microbiological research on how fungi evade the human immune system. Because treating a yeast infection while you're on estrogen, it isn't just an annoying coincidence.
No, not at all. It actually triggers a biological cloaking device, basically, and a massive chemical traffic jam in your body.
It's crazy. And to understand how all these pieces fit together, we need to bridge the gap between microbiology and pharmacology.
Yeah, because it's not just about the drugs themselves. We really have to look at the microscopic battlefield they're entering.
Right, the terrain.
Exactly. The terrain of that battlefield completely changes the rules of how your body absorbs medication.
Okay, so before we can even talk about how an infection changes drug absorption, we really need to understand why the estrogen attracts the infection in the first place.
Right. We have to start there.
Because typically the baseline state of menopause actually works against yeast, doesn't it?
It does. It's this fascinating biological irony. During perimenopause and menopause, as your systemic estrogen levels naturally decline, the tissues of the vaginal wall undergo atrophy.
So they get thinner, drier.
Fitter, drier, much more fragile. But crucially, the local pH environment completely shifts.
Right.
A healthy premenopausal environment is highly acidic, and that's maintained by good bacteria. But without estrogen, those good bacteria decline, and the vaginal pH rises, so it becomes much more alkaline.
And yeast, specifically Candida albicans, is not a fan of an alkaline environment.
Not at all.
Yeah.
Postmenopausal women who aren't on any hormone therapy actually have a remarkably low rate of yeast infections.
Wow, really?
Yeah, the environment is it's too alkaline and too dry for the fungus to thrive.
Okay, makes sense.
But then, a patient experiences the discomfort of this atrophy, the dryness, the recurrent urinary tract infections, and their doctor appropriately prescribes a topical vaginal estrogen cream to restore that tissue.
So the estrogen comes in and essentially turns back the clock for that local tissue.
Exactly. It stimulates the maturation of those cells, it thickens the mucosal layer, and importantly, it promotes the production of glycogen.
Which is a sugar, right?
Right? A type of sugar stored in the tissue. And this brings the good bacteria back. They eat the glycogen, they produce lactic acid, and that drops the pH right back down to a healthy, highly acidic state.
But wait, okay, let's unpack this. A highly acidic environment that is absolutely packed with sugar, that is exactly what yeast thrives on.
You've got it.
It's like meticulously renovating a house to make it perfect for yourself, only to realize you've accidentally built a 5-star resort for pests. You've just created the ultimate yeast utopia.
It really is. By restoring the healthy, youthful state of the tissue, you inadvertently set the perfect table for the fungus to overgrow. You've provided the ideal pH and this abundant food source.
That brings up a wild question, though. I mean, the estrogen makes the neighborhood really nice for the yeast, sure.
Right.
But is the fungus just passively enjoying the new real estate? Or does it actually know the estrogen is there? Like, does it sense it?
Oh, the fungus is absolutely not a passive observer here.
Yeah.
No, it doesn't just eat the byproducts of the estrogen. It actively detects the hormone itself. And it uses your hormone as a weapon to hijack your immune system.
Okay, here's where it gets really interesting, because I read the microbiological studies in our stack, and the numbers are just staggering.
They're huge.
Researchers exposed this yeast to the strongest forms of human estrogen to see what would happen, and they saw a 50% drop in the ability of human white blood cells to eat and destroy the fungus.
Yes.
I mean, the immune system is suddenly operating at half capacity right at the site of the infection.
Yet it's incredible. The yeast actually adapts to the estrogen by altering its own cell surface.
How does it do that?
So when the fungus senses the hormone, it uses a specific fungal surface protein to aggressively bind and accumulate a human protein called factor H.
Wait, if it's pulling factor H onto itself, our own cells normally use factor H as an ID badge, right?
Exactly.
It tells the immune system, hey, don't attack me, I belong here. So the fungus is basically stealing our cellular ID badges.
It is. It basically creates this molecular invisibility cloak, completely blinding your innate immune system to the presence of the yeast.
That is terrifying.
And to make matters even more incredible, researchers discovered that this specific fungus possesses its own internal estrogen-binding protein.
Wait, really?
Yeah, it has literally evolved over millions of years to listen for our reproductive hormones and use them to increase its own survival rate.
That is just wild. It's pulling a Jedi mind trick on our white blood cells using our own prescription hormones.
Essentially, yes.
But, okay, if there's this massive cloaked fungal infection multiplying rapidly in the exact same physical space where a patient is applying their estrogen cream,
Right, locally.
that tissue has to be taking a beating. How does that physical damage change the way the cream is absorbed?
Well, the state of the tissue barrier is everything when we talk about drug delivery.
Okay.
In pharmacological studies looking closely at the human cells that line the vaginal wall, researchers measure something called transepithelial electrical resistance, or TEER.
TEER. Okay, what does electrical resistance tell us about human tissue?
Think of the cells lining the vaginal wall like bricks in a wall, held together tightly by mortar.
Got it.
That mortar represents what we call tight junctions. When the tight junctions are healthy and intact, they resist the flow of electrical current, because the barrier is solid.
Makes sense.
But studies showed that when you expose these epithelial cells to both estrogen and an active yeast infection, the resistance value just plummets.
Meaning the mortar is washing away, the bricks are separating.
Exactly. The tight junctions become compromised and leaky.
Wow.
And estrogen already naturally increases the permeability of the tissue slightly just to improve blood flow and moisture.
Sure, that's what it's supposed to do.
Right. But when you add the root-like structures of the yeast that physically invade and break down that mucosal cell layer,
Ouch.
yeah, you get a tissue bed that is highly inflamed and hypopermeable.
Which completely breaks the primary promise of vaginal estrogen. I mean, the whole selling point doctors give patients is that it stays local.
Yep.
It's supposed to go straight into the urogenital tissue, bypass the rest of the body, and basically barely register on your systemic blood tests. It's supposed to be incredibly safe because it doesn't circulate.
Right, but you no longer have a reliable barrier. So the localized drug now has a much easier pathway to just slip directly into the systemic bloodstream.
Okay, so we have a double whammy developing here.
We do.
The tissue is physically broken, allowing more estrogen into the blood. But naturally, a patient suffering from this awful infection is going to head straight to the pharmacy for an over-the-counter antifungal treatment.
Of course they are.
And they're going to use that alongside their daily or weekly estrogen cream. Aren't they now mixing powerful chemicals in a highly compromised zone?
Yeah, and this brings us to a massive chemical collision. Because it's not just the physical tissue barrier that's compromised, it's your body's chemical clearance pathways.
How so?
Any estrogen that does make it into your system is primarily cleared out of the body by a specific waste disposal enzyme in your liver and tissues.
And I recognize this from the sources. We see that specific enzyme, CYP3A4, pop up in so many drug interaction warnings.
Oh, constantly.
It's essentially the exit lane for clearing out hormones and medications, right?
It is. And the most common medications used to cure vaginal yeast infections, the azyl antifungals you find on every pharmacy shelf.
Like miconazole or fluconazole.
Exactly. They're notoriously strong inhibitors of that exact enzyme.
It's like a traffic jam at a coal booth.
That's a great way to put it.
Because the physical tissue is broken down, extra estrogen is flooding onto the highway. It tries to leave the body through the exit lane, but the antifungal medication comes in and completely barricades the exit.
Right.
So the estrogen has nowhere to go, and it just backs up into the systemic bloodstream.
And we have clinical drug interaction studies that show exactly how dramatic this traffic jam gets.
What did they find?
Well, researchers looked at patients using a common vaginal ring that releases a steady dose of estrogen. When these patients were given a single high-dose antifungal suppository, their systemic exposure to estrogen spiked by approximately 67%.
Wait, a 67% increase from a single dose?
From a single dose.
And it's not just the massive single doses, right? I saw in the data that even if a patient uses a lower dose suppository over 3 consecutive days, The systemic estrogen exposure still jumps by over 40%.
Yes, exactly.
By shutting down that exit lane, you force the body to hold on to all the estrogen it would normally clear away.
And this creates a very confusing situation for the patient,
Hmm.
because you absolutely must treat the active infection,
Obviously.
not only for comfort, but to restore the physical integrity of that brick and mortar barrier we just talked about.
But how do you treat it without causing that massive hormonal spike? I mean, imagine a patient standing in the pharmacy aisle. They're uncomfortable. They're staring at 20 different boxes of yeast infection treatments that all look identical.
Oh, the branding is exactly the same. The promises are the same.
So how are they supposed to know which one barricades the exit lane and which one is safe? Should they just not treat it?
No, no, they definitely need to treat it. But it comes down to one of the most practical, fascinating takeaways from our source material. The physical vehicle of the antifungal matters just as much as the active drug itself.
The physical vehicle.
Yeah, it basically comes down to oil versus water.
Oh, you mean the inactive base ingredients of the medication?
Exactly. The clinical studies explicitly distinguish between oil-based antifungal suppositories and water-based antifungal creams.
Okay.
Those massive spikes in systemic estrogen, that 67% increase, occurred specifically with the oil-based suppositories.
Interesting.
Oil-based vehicles dramatically increase the release and exposure of the estrogen. Furthermore, if you're using an estrogen ring made of certain plastics, the oil can actually physically degrade the ring itself.
Wow. That explains why the data on water-based creams look so different in the sources.
Right.
Because in those exact same drug interaction studies, concurrent use of a water-based antifungal cream resulted in no significant change in the systemic exposure to the estrogen.
Yeah.
The water-based vehicle simply didn't force the same chemical collision.
Exactly. The water-based vehicle doesn't trap and accelerate the estrogen absorption the way the oil-based does.
That is a massive distinction that is totally buried in the fine print.
It really is.
Most doctors just say, go grab something over the counter without mentioning that an oil-based suppository will spike your hormones, while a water-based cream will keep your levels stable.
It's a crucial detail.
But even if a patient successfully navigates the pharmacy aisle and buys the water-based cream, they still can't just apply everything all at once, can they?
No, they can't. The prescribing guidelines for these estrogen products are very clear on what we call the 2-hour rule.
The 2-hour rule.
Yes. You should never insert a vaginal antifungal and a vaginal estrogen product at the exact same time,
Even if it's water-based.
even if it's water-based. Doing so can physically dilute the estrogen cream or alter how an estrogen tablet dissolves. You must separate the administration of these two products by at least 2 hours.
Okay, so you use the antifungal, wait at least 2 hours, and then apply the estrogen, or vice versa.
Exactly.
What about the pill, though? A lot of times, just to avoid the messy creams altogether, a doctor will just prescribe a single oral antifungal pill. Does swallowing a pill solve this whole local interaction problem?
Well, taking an oral pill does completely bypass the local physical mixing of the two creams in that compromised inflamed environment.
Right, they aren't touching.
Right, so you don't have to worry about oil degrading a ring or creams diluting each other. However, you still have to remember the chemical traffic jam.
Ah, because the pill still goes through the liver.
Exactly. The systemic medication inside that pill is still a strong inhibitor of your waste disposal enzyme, that CYP3A4.
Right.
So while it avoids the local physical mess, the FDA sources still carry warnings that oral antifungals can decrease the clearance of estrogens systemically.
So it still barricades the exit lane.
Yes. It's often the preferred route just for convenience, but that pharmacokinetic interaction in your liver absolutely remains a factor.
Okay, before we wrap this up, I did notice a really hopeful note in the microbiological sources about a potential biological shield.
Oh, yes.
We spent a lot of time on how the fungus uses estrogen to cloak itself and break down tissue. Are there any good microbes that can actually fight back without messing up the hormone therapy?
There are. The research highlights specific strains of good probiotic bacteria.
Like which ones?
Well, certain strains, like Lactobacillus reuteri, have actually been shown in studies to restrict the estrogen-induced germination and growth of the yeast.
Oh, wow.
And the best part is, they don't interfere with the estrogen therapy. Instead, they act as this non-interfering protective layer.
They just hang out and keep the neighborhood safe.
Exactly. They produce hydrogen peroxide and keep the environment acidic, which directly counters the fungal overgrowth even when the estrogen is heavily present.
So they provide a buffer.
Right, a buffer that protects those cellular tight junctions, the mortar we talked about earlier.
This completely changes how I view a standard infection. So, what does this all mean? Let's recap this journey for you, the listener. Vaginal estrogen therapy is an incredible tool for treating the painful symptoms of menopause.
It really is.
But by restoring a youthful, acidic, sugar-rich environment, it inadvertently creates a perfect storm for yeast to thrive.
And once that yeast takes hold, it actively senses your prescription estrogen and uses it to steal your cellular ID badges, cloaking itself from your immune system.
Which is still just mind-blowing to me. And while it's cloaked, it physically breaks down the mortar between your cells, making the tissue barrier hyperpermeable so estrogen leaks directly into your blood.
Yep.
Then, if you treat that infection with an oil-based antifungal at the wrong time, you block your body's exit lanes, causing a chemical traffic jam that can accidentally spike your systemic estrogen levels by nearly 70%.
But knowledge really is power here. Understanding these microscopic and chemical interactions allows you to safely manage your health without giving up the immense benefits of local estrogen therapy.
Right.
You can advocate for water-based antifungal treatments at the pharmacy, firmly adhere to the 2-hour spacing rule between medications, and even look into targeted probiotics to help maintain that balance.
It's a great reminder that when we apply a simple tube of cream, it's not just a localized fix. We're actively participating in an incredibly complex, evolving, microscopic ecosystem.
And if we connect this to the bigger picture, it leaves us with something quite profound to think about.
Yeah.
We now know definitively that this common fungus possesses an actual estrogen-binding protein. It has spent millions of years evolving to literally eavesdrop on our reproductive hormones, using our own endocrine signals to increase its virulence and hide from our white blood cells.
It's literal microscopic espionage.
It is. And if this one common fungus is actively listening to our hormones, we have to ask, what other microscopic organisms in our microbiome are quietly listening to our endocrine system, just waiting for the perfect hormonal shift to make their move?
That is a thought that will stick with you the next time you pick up a prescription. You aren't just treating yourself. You might be talking to your microbes.